minute to remind everyone to please mute their devices before we get started. Take it away, Mayor.
Okay, Jess, thanks very much. And for the media, feel free to chime in the chat box as well. So thanks, everybody, for joining us on our daily 4 o'clock briefing. There's a lot to talk about today, so let's start with our data. Here's where we're at as of this morning. As of this morning, there were 60 positive cases in Jefferson County. For context, earlier in the week, just 2 days ago on Tuesday, we had 31 confirmed cases. So we've nearly doubled in 2 days. We expect that number to continue to grow. The more rapid increase is something that we've known would happen, and it's something that we've been preparing for, and something more importantly that we've been trying to prepare you guys for as well. Now, testing is ramping up in the community, so that's one of the reasons why we're going to see more cases, but we obviously suspect that there's more spread taking place in the community as well. As we identify more cases, it gives us a better handle on the size of the community spread in our cities, so that will give us data that we need to help slow it down as well. But look, slowing down the spread in the first part of our media briefing here today is going to be about talking to you as a citizen about what type of sacrifices that you can make to help us slow the spread. The reason why this is so important is because some people still are not getting the issue here on what we need to do to slow the spread in the community. So that was why earlier this week, I expanded the executive order that I'd signed, canceling all events throughout Jefferson County through May the 10th, and taken the additional step, which I did not want to do, but has been necessitated to do because some of the public is still not doing what needs to be done. So I took the additional step of closing metro parks, basketball, tennis courts, soccer fields, and other facilities. Now, I will say that most people have respected that order, but we are continuing to get reports of people who are still acting like this is not a crisis. So some of them are kids, and here's some pictures of what I'm talking about here. Some of them are kids who may not fully understand what's at stake. But the bottom line, and it is what I'm upset about, and I'm upset about it because people are putting other people's lives in danger, not to mention their own. So we are just seeing too many people of too many ages and too many demographics thinking that it's still okay to gather in groups in our parks, despite the risk of spreading this disease. Look, I would love to be out playing hoops right now and doing these type of things, but we cannot do it. Okay, this is going to lead to more illness and possible death from these young folks if they don't get seriously ill, passing it on to their older relatives and friends. So this is why I really want to emphasize this today. First, to parents. I know this can be a really scary thing when you're trying to explain to your kids what's happening and what this virus is all about. So, we have to, part of being parents is we've got to say the uncomfortable stuff to our kids, and we do that because we love them. And that's why we got to tell them the reality of the situation. So we got to let them know that playing with their friends without being distant is a way that's just going to bring the virus into your house and cause some potential hurt and damage. So parents, please step up, do what you know you need to do as a parent, and have that conversation with your kids. To adults out there and everybody that still has not fully accepted the seriousness of this crisis, I would just say that it's one thing to risk your life and your own health, but this is a deadly and contagious disease. If you don't believe me, turn on the TV and look at the images that you see in Italy and Spain, in our own country now, in New York City, and ask yourself, this is serious business here. So this disease spreads very easily among people in close contact, including between people who don't even know they have it. That's where a lot of the spread is taking place. So that means, like on the picture we just saw, that when you're playing basketball, let's say, you may have it, you don't know it, you're spreading it. You can spread it by coughing, sneezing, breathing on someone. You can spread it through the basketball that's passed around. If you're playing tennis, some people say, well, we're far apart. True. But when you touch the tennis ball, it can spread that way. Soccer, the same thing. Anything when you're standing within 6 feet of somebody or sharing sports equipment or touching surfaces, you are risking the lives and health of other people. You cannot do that. Okay? You're not just risking your own life, you're risking the lives of many other people as well. So it applies to everybody. Please do not be selfish. Do not be short sighted. Do not be so self absorbed that you just think this is all about you. Everybody loves somebody. Everybody loves you. So think about those folks when you're thinking about being acting like this doesn't apply to you. It applies to everybody. So we just can't have it. And I get that this is really hard to accept. I wish it wasn't taking place either. The last thing I want to do is be talking to the people of Louisville like I'm talking to them right now. But my job is to help save lives. So if I've got to put out the brutal reality of this, which I'm going to talk about a little bit more in a minute, I'm doing that because you deserve to get the straight facts. Okay. So when you think about other things, I mean, there's a reason right now why U of L and UK are not in the NCAA tournament. And the Cardinals will be racing toward the Final Four right now. There's a reason why the NBA isn't playing, and Louisville City isn't playing, and pro tennis tournaments are being canceled or postponed because these are simple, beautiful games that we love. But the bottom line is they can kill people right now. We've got to understand that and absorb that. And I know that's hard to hear, but that's the truth. So you absolutely have to stay 6 feet away from other people for the time being. Not forever, but for a while. Okay. We all got to think about this like we're in a big competition right now. And the human race is on one team. Louisville is on one team. And we're competing against the virus. Okay. So you got to say to yourself, I may not be on the basketball court right now, but my job is to do everything I can to beat that virus. So that means I got to take care of myself, take care of others, be socially distanced, and don't treat this like it's a joke. We need you. We need everybody on the team to be successful here. Okay? So it's all about limiting interpersonal contact because that's how we know the virus spreads. Right? Around the world now, we're seeing people dying and hospitals filling up beyond capacity. And it's happening in our country right now. This is not something that's happening offshore. This is an image from New York City right now. These are people lined up to get care at Elmhurst Hospital Center in the Queens. And the Queens in New York is now the epicenter of New York City. I want to share this newspaper account of what's happening in the Queens. And this is hard to hear, and it's hard for me to say. But as I said, part of my job is, I want to uplift the city. And certainly we've got a lot to uplift ourselves about. But for us to close our eyes and act like this can't happen to us, we're in a wonderland. My job is to tell the brutal truth. Here's some of the brutal truth coming out of New York right now. This is from the New York Times. Dr. Ashley Bray performed chest compressions Tuesday on a woman in her 80s, a man in his 60s, and a 38-year-old who reminded the doctor of her fiance. All had been tested positive for the coronavirus. All eventually died. Some patients have died inside the emergency room while waiting for a bed. A refrigerated truck has been stationed outside to hold the bodies of the dead. It's apocalyptic, said Dr. Ray. All of the more than 1,800 intensive care units in New York City are expected to be full by Friday, tomorrow. Folks, I hate to say it, but this is possible in our city if we do not spread or do not stop the spread of the virus. And we cannot, for one moment, think for whatever reason we're exempt from that just because we're in our city. We have been doing good stuff. Most everybody has been doing the right thing here in our city, and we are ahead of many cities. So we hope and we pray that that is going to have a benefit for us. But what we have heard and what we know, if you can spread this virus quickly to 400 people. If you're out and you've got it, those 400 can then spread. And this is why you see this moving and spreading so in such an exponential fashion. So to beat COVID-19, all of us have to accept that we've got a job to do. We have to stay at home as much as possible. Keep that 6 feet of distancing we're talking about. While we're doing that, it means it's okay to get outside and walk and jog and enjoy nature. It's a beautiful day here today, but you have to keep 6 feet of distance, okay? And so at this time, Louisville Parks and Recreation is removing all basketball nets and rims, all tennis, pickleball court nets, along with locking up soccer goals throughout the city's parks system. I hate to say it, I'm sorry about it, but your life's more important than the next pickup game. In addition to that, we're going to continue to place signage around our 180 individual playground units indicating those two remain closed. As kids climb on the playground equipment, if they have the virus on their hands, they can leave it on the equipment. Your kid comes behind them, your kid gets the virus, your kid hugs your granny, granny gets sick, she's got chronic conditions, granny doesn't make it. And that's how this works. And that's why these actions are necessary. And all group sporting events and group activities are prohibited on multi-purpose fields and open spaces. Okay? I wish this was not necessary, but it is. And I know we can all pull together to get this done. Right? And if you're seeing something that's where groups are gathering, again, you can dial 311 and let us know. Our police are trained in how to handle this and quietly disperse any of these gatherings. We don't want any drama for everybody. Everybody's just got to understand they got to do their part. Okay. I know we all look forward to resuming our activities, and we will do that when the data indicates it is safe to do that. We are not going to set a date that's going to drive this. We're going to follow data. We're going to follow science. We're going to make sure that we've got healthcare capacity that's up and running. We're going to make sure we have a public health department can do what they need to do, and the people are getting better and the cases are going down. That's when we'll look at removing our restrictions. Everybody, too, I want you to really pay attention to this federal stabilization bill that will be passed, I'm sure, in Congress tomorrow. The president will sign it. That is going to then get you if you're unemployed right now, will get you 4 months where you're going to be in good shape. Okay, I know there's a lot of financial anxiety out there right now, and that's really natural. So what happened yesterday with the Senate passing it, Congress will pass it tomorrow, president will sign it. That means unemployment is going to be keeping you whole at your salary that you had before for almost everybody in the country, in addition to the direct checks that will be coming your way of $1,200 per adult and then $500 per child. So with that financial anxiety kind of relieved, that'll help us all to even focus more on defeating the virus. Okay, we owe that to each other. Now, we want to keep messaging the importance of this. So to help make sure that everybody understands what's needed, especially when it comes to social distancing, we're working with some outstanding community partners who've reached out to offer some assistance in messaging about social distancing. So today I'm announcing our Better Together by Staying Apart. And I know that's a paradox, but in this time right now, we got to be staying together, connected, but we can only do that if we stay apart. Okay, so Better Together by Staying Apart is a collaboration with Passport Health Plan and the University of Louisville, go Cards, and U of L Health. So this is an awareness campaign whose goal is just to spread the word about the importance of social distancing. It is uncool if you are not being socially distant right now, okay? That means you don't know what's going on. It means you're not very smart. It means you don't care about people. And I know the people of Louisville do care about people, are compassionate, are smart, and want to do the right thing. So when you've got the facts, you will do the right thing, and you will reinforce that with your friends as well. So that's the purpose of this campaign. And you'll start to see billboards, posters, and TARC shelters and buses and other places. And of course, social media graphics. And the posters and the social media graphics will be available for download. So everybody can start spreading these around. And we just want to be sure that everybody hears these key messages. Limit your outings to essential needs only. Avoid close contact with other people. Maintain 6 feet of safe distance between yourself and others outside your home. Wash your hands and avoid touching your face as much as possible. Clean and disinfect surfaces that are frequently used and people are touching. Cough or sneeze into your elbow or tissue. If you're sick or have a fever, stay home and call your healthcare provider for advice. So we ask our friends in the media and everyone really to help us share this message, and we will save lives as a result of that. We don't want to look like what New York City is looking like right now, folks. So if everybody does their part, we won't. I want to thank Passport Health Plan for stepping up. I want to thank U of L and U of L Health for stepping up. They've been doing it throughout this emergency, and I know they're going to continue to do it again. So let's show the rest of the country and the world that we, in fact, can be better together by staying apart. All right. One of our champions in the community that has been sharing that with us is Dr. Sarah Moyer. She's our chief health strategist, and Sarah, has 4 kids, 4 beautiful young kids. A lot of us are relying on our families to help us through this. Sarah's mom came down from the Chicago area to help Sarah and her husband with their kids, so Sarah could, give it all for the city during this public health crisis. So, Dr. Moyer, I appreciate you, your mom, your husband, your 4 young kids for helping us get through this as a city. Dr. Sarah Moyer, what's happening today?
Yeah, thanks, Mayor. It really does take a team to get through any crisis. So I really appreciate that you're constantly and a strong advocate for us to stay at home and practice social distancing measures. And I understand that it really is a shame that we can't fully enjoy our parks right now. The weather is warmer. Everyone wants to be active and outside, but it's really essential for us to take these measures. I know my kids are really mad that they can't go play in the playgrounds, but they are staying home and staying in our yard, and they're safer because of it. And just for everyone else, remember that COVID-19 spreads easily and quickly. It's highly contagious. And to stop the spread, we want to eliminate contact with others. So think about it. When you're playing soccer or basketball or any number of sports, you've got sweaty people bumping into each other, all touching the same ball and wiping sweat off their foreheads and then touching the balls of each other. It's a perfect situation for COVID-19 to spread. Removing our basketball goals means we nudge people away from them by removing the allure, and we take away the desire for public spaces by closing them down. So just thanks for pushing that message, Mayor, and hopefully people are finding other ways to enjoy the outdoors 6 feet away from each other. So now I want to switch to food safety. With many of our grocery stores open, as well as our local restaurants and food establishments, I also want to give some tips on takeout food and groceries today. So according to the CDC, there's currently no evidence that COVID-19 is spread through food or food packaging. However, to be safe, if you get takeout or delivery, you can transfer the food to clean plates or storage containers, dispose of the original packaging, and then wash your hands before eating. While we don't have any information about this novel coronavirus, studies have shown that other coronavirus species can be killed through microwaving. So you can also warm up the food in the microwave if you wanted to be extra safe. When you're shopping, recommend leaving those reusable bags at home because we know for a while that germs can live in those. Only touch the items you're going to buy and keep your distance from other shoppers and use a touchless pay system as possible when paying. And then before you get in your car, make sure to use hand sanitizer. And then when you enter your house, wash your hands as well. And then if possible, leave your non-perishable items outside your home. For example, if you have a garage or a storage area until you need them, this will give a little bit of time for the virus to die on its own as well. Some other items may have multiple layers of packaging, so you can remove the outer packaging and dispose of it. So for example, a box of cereal, you can throw out the box and keep the plastic bag inside and then wash your hands, and that's just just some extra safety measures you can take. You can also put some items that come in plastic bags into clean containers, and like always, wash your fruits and vegetables before putting them away. And I can't say this enough, wash your hands before preparing or eating food. It really, that's the way the germs get inside your mouth, inside your body, is through your hands. And so washing your hands after you're outside your house, touching anything that you don't know where it came from, just wash your hands before eating. And then just remember, the most important thing is to stay home. Try to limit your outings for essential needs like grocery stores to just once a week. And staying home is the best tool we have for stopping the spread of COVID-19. So with that, thank you, and I'll be happy to answer questions later.
All right, thanks, Dr. Moore. We appreciate that. I mentioned earlier about the federal stabilization bill that should be passed tomorrow. We will have at louisvilleky.gov in the next day or two kind of the simplified version of the bill, and so we can answer that question of, what does this mean to me? Run some scenarios so that you can understand how to both apply if you need to do that. Much of this stuff's going to come direct to you if you're a taxpayer, but so that you can put your mind at ease here on some of the stimulus or payments coming directly to you. Also, I want to mention just small business. There's a tremendous amount of small business relief and big business relief in the stabilization bill as well. So we've got to make sure that our economy stays working. So when we all come back to work, that we're not going to be going into a great recession or depression of any kind. And that's a big focus of everybody right now. We have had some tremendous response from our bourbon community. That's right. Bourbon is coming to the rescue. And think about when Prohibition was in place, some of our bourbon distillers rose to the occasion because they provided medicine in the form of bourbon that was vital to the national continuity. Well, that's what happened during Prohibition at that time of emergency. So now we got another emergency here with COVID-19. And one of the great things about what's going on is how people and organizations continue to step up in this crisis, and they do it through innovation. So one great example of that is how our bourbon distilleries have adjusted, and they ask themselves questions. Because our bourbon industry, folks, is obviously the best in the world. There's no really close second place. But these folks, they invest in their communities, invest in their employees, and always just do high quality work is amazing in normal times. Now they're doing it in this time of crisis. So they said, how can we help? And we said, we're short on hand sanitizer. So the adjustments of the distilleries to producing hand sanitizers, which obviously is incredibly important, especially for healthcare responders and first responders and others. It's never been more important. So Rabbit Hole, Heaven Hill are both doing it, and so is Brown-Forman. These companies are providing thousands and thousands of gallons of hand sanitizers to hospitals, Kentucky Emergency Management, to our first responders. Ralph DeChabert is on with us today. Ralph is a great community citizen, very effective in so many different ways, leads a lot of Brown-Forman's efforts. Brown-Forman, I want to say, has given $1 million to fight COVID-19 efforts or to help COVID-19 efforts to fight the virus. And they're also a major contributor to our One Louisville COVID Relief Fund, which is now over $5.5 million from community giving. Everybody can still give to that. Go to louisvilleky.gov, see that on the top left page. You don't have to give like a big company does, but if you got $10, $1,000, please help us out. So Ralph DeChabert is joining us to tell us how this effort came together around distillers stepping up and helping with hand sanitizer. So Ralph, take it away, buddy.
So thank you, Greg. And I look forward to having a bit of a conversation with you and others in the community. But the one thing that I think is important to say is there are people in Brown-Forman, and I'm thinking specifically about folks like Jimmy Bookstore and Chris Teeley, who with their teams got together and said, how can we have some impact? How can we do something in our communities? And you ask the question, why? And the answer is really simple. It's a real love for our community. It's also about giving back. And I know sometimes this sounds trite, but truly is important to our employees. It's important to our Brown family members. And the fact of the matter is that it's important to the folks who are on the front lines right now doing this work, who in fact are risking not only health, but their lives. And that's not an understatement. And so we stood back and said, well, okay, given all of those realities, what can we do? And the answer is we could look at the World Health Organization and we could figure out the formula and actually make sanitizer. And so that's what we did. And again, Chris Steele, his team, Jimmy Bookstore and others, they figured out a way to do it safely because that was a key component to this. Could we in fact do this and make sure that everyone is safe in the process? And in fact, that's what we've done. And so we've made about 14,000 bottles of sanitizer. Now, that's what's interesting about that is that it takes us, and we have to do it by hand, and it takes us about a day to do approximately 2,000 bottles. And recently we sent 4,000 6-ounce bottles to Norton Healthcare. And what we also, and we've sent bottles to other organizations as well. But what we've realized is that bulk orders, bulk shipping is really very, very important. And so what we've done is we've sent 1,705 gallons. In fact, that went out this morning to the Kentucky Emergency Management, and that's 31 kind of 55-gallon drums. And some of that will be redirected back to Louisville. But we've also sent 220 gallons to EMS here in Louisville. Along with that, we've sent gallons to other locations and in other cities, in fact. But I think the important piece for us is that this, I think, reflects our level of caring for the city. And we know at the end of the day that we can't do enough for those folks who were there on the front lines doing this work on behalf of all of us. And so we're just trying to do our small part to make a difference. And what I would say to you is that given the fact that the bulk shipments and the bulk work is, I think it moves this faster, it gets to more people sooner. We are in a process right now of seeing if we can develop some relationships with others who are in this space so that we can, in fact, make more faster and get it out to more people. So that's our story for the moment. And again, quite frankly, it's humbling to be asked to share a couple of perspectives around this because we just want to quietly try to do what's best for as many people as possible in our city.
Ralph, thank you, man. You've got a beautiful way of stating that as well. So I think the heart of our bourbon industry, the heart of Brown Forman, what you all do, for our arts community, for our homeless community, for food stability, for the California neighborhood, and Russell, where you guys in, is just a great example. Got a lot of great companies in our city, but Brown Forman and your example is just tremendous. So I want to say thank you very much.
Thank you very much.
And it's amazing, as you say, when you give people the latitude in your company just to ask the question how we can help, and the creativity that comes forth and the meaning that brings to them. We just can't put a measure on that. So great job. Thank you.
Thank you.
Another example yesterday, Dare to Care, our great food bank here, put out a message that they needed 20 to 30,000 more square feet because they're busier than ever right now, right? So they need more space so they can package more food, so they can help more people in this time of crisis. On the call yesterday, I had two people text me during the call saying they were available to help. So we had multiple organizations stand up and say they were ready to help. So Corey Scholl from Burnett Avenue Baptist Church, I want to thank him. I want to thank Todd Dunn from the United Auto Workers. And I want to give a big shout out to Summit Construction. Summit Construction has got a new facility that is right down the road from Dare to Care. Councilman Barbara Sexton Smith was able to connect them and Dare to Care. They're already evaluating. They're already there at the site. No one dare to care. It's probably going to be activated like within hours. So I want to thank Summit and UAW and Burn Avenue and Councilwoman Dare to Care. That's amazing, folks. Okay, that is the power of what we can do when we come together. And that is the power that you just saw with Brown Forman and kind of another advantage of being the home of urbanism. So there are so many amazing stories going on in our community right now, whether they're big stories like the ones I just shared or just the common everyday kindness that people are showing to each other. And when you got a neighbor that's a little bit older, they can't go to the grocery store. Thousands of people are doing that today in Louisville, right? So we got a wonderful community, and I'm really proud of everybody for standing up and just thinking through that lens. How can I be part of the solution? So please keep sharing your stories with us. It inspires other people to do even more. So we know we're going to get through this. We know we're one day closer to the end. And as we share these great stories with each other, it's just going to make it all that much better while we practice social distancing. All right. All right. Well, let's transition over to media questions right now. We have one question so far, and that is from another one coming in. But Darcy Costello with the Courier Journal. Darcy, I want to thank you for how you're covering all of this. You're very busy. I know that. But thanks for covering this and spreading the word with people and informing them more about how they can be part of the solution. So I'm going to ask Dr. Moyer to handle this first question. It is how many speedball attendees have tested positive?
Hey, Darcy, I think the important thing to remember is that COVID is all over our community right now. And so it's hard to, going forward, just anytime you leave your house, you're risking getting coronavirus. And so just the same messaging, stay home when you go out. If you're an essential worker, go to work. When you get home, wash your hands, wash your clothes. Those are the important things to think about. Everybody who was a close contact of the case at the speedball was contacted and put into quarantine, just like Mayor Fischer. And so those people are following our directions, and most of them should be out here soon.
Okay, thank you, Doc. Let's see, Mayor Fischer from Wave, are you concerned about the recent episodes of groups of teens fighting throughout the city? We're aware of a couple of them. I'm not sure how rampant it is, but of course we would be concerned about that. When you get large groups of teenagers together, they're going to do what teenagers do, which is unfortunate. So I would ask every parent to know where your child is, parent, grandparent, guardian, whomever it is. That is part of your responsibility right now. When there are large groups of people together, we're asking our police officers to break them up, give them a little public health tip so that they understand what their role is here. So that is something that LMPD is obviously monitoring. A Wave is asking, why can't people play tennis if they stay apart? Because, well, they're practicing one part of the solution, which is social distancing, but we know the virus stays on surfaces. Okay, so the surface in this case is a tennis ball. So you can't play tennis if you're not handling the ball. So the virus can transmit that way. And I wish it wasn't that way, but it is that way. So that's why that unfortunate decision has been made to take down the nets. So somebody, I guess, could find a wall to hit balls against. And if, as long as they're doing that just by themselves, that would be okay. Okay, Darcy is coming back with another question. Is the current capacity for unsheltered COVID-19 patients in need of quarantine or isolation beds enough citywide? And what solutions is Metro government exploring? Sarah, I'll kick that off, then maybe you can add some comments to it. We have 150, okay, this one's on quarantine or isolation. So we have up to 150 spaces. The Salvation Army has risen to the occasion again. At their Joy Center in South Louisville is where we can isolate unsheltered, also known as homeless individuals, if they need that solution. So that's a lot of capacity. We don't see ourselves getting beyond that, but if we do, we'll see that number rising and we'll adjust accordingly. Dr. Moyer?
I was going to say the same thing. So yeah, I have plans in place right now that are more than meeting the needs that we have. and have other plans ready to roll out as that need might increase.
Okay. Marcus Green from DRB is asking, can you provide some commentary on the severity of cases in Louisville? How many people are hospitalized, fully recovered, et cetera? What kind of activity are we seeing in the hospitals?
Most of the cases that we are testing so far are hospitalized. I don't have exact statistics, but we can get those to you. And it changes every day. So for a lot of people, the disease starts out as mild, and as it progresses, they may become hospitalized. And so a lot of that data we'll have after the fact as well, too. When people are recovered, we could more accurately reflect the severities. So more to come.
But what we can say is we've got more than adequate capacity in our hospitals right now. That's a question, right? Would you agree with that?
Yes.
Yeah.
Yes, okay. I would agree with that. Yeah, our hospitals have plenty of capacity right now, and they've all have plans to expand, and just working with them as their needs change and are ready for that in the future.
Right. So good point. Each of the hospitals has their own surging plan. We have a community surge plan in case additional beds are, and then we're monitoring that data, obviously, that would indicate moving into the next phase of that. And then, Dr. Moore, on the COVID-19, when you have the flu, you usually get through the flu in, let's say, a week from the time you feel bad, you're in the depths of it, and you recover. And one of the things we're seeing with COVID right now for folks that have beyond moderate symptoms is this has taken longer to move through. Is that accurate?
No, that's very accurate. I mean, I think it's average about 9 days to when people get very severe symptoms. But then, I mean, reports from other countries, some people are on ventilators and sick in hospitals for weeks, like 3 to 6 weeks. So it just really depends on what's going on. But yes, it's a longer process than the flu. And when we say mild case too, I think there's some confusion there. Mild just means that you're able to get sick and recover at home and not need hospitalizations, but people can feel pretty sick with it. I mean, I've been hearing from friends and family and other reports that, I mean, it feels worse than the flu. So mild still is not mild, but it's mild enough you don't need hospitalization.
Well, one of the critical points here is, since it takes longer to recover from this on severe cases, when we talk about ventilator capacity, those vents can be tied up now longer on one person than what we're used to, right?
Yeah, no, that's it. And that's why all the hospital systems and across America and the world are looking at increasing vent capacity just to be prepared for that.
So the point, another point of this is, if people are saying that's bad, what we're saying to you is help us with your social distancing.
I mean, the good news is so far the data from the state shows the average hospital length of stay for the patients that we have right now is about 2 days. So we're not seeing that yet, but we're preparing in case something changes.
Okay.
Because, I mean, as you know, most of the cases we have right now were in people who've traveled or in our higher social economic realms. And so we know as that transfers down to other areas of our community and then people with more comorbidities, that outcomes might be different.
There's a question on PPE, and is there an update on PPE stockpiles at hospitals?
PPE is something we're tracking with all our hospital systems. We're tracking what they have and how fast they're going through it. And so just keeping an eye on that. And then our team, I know all the hospital teams are actively working on trying to find new supply chains because it's a unique situation when the entire world wants the same thing that we're not used to supplying. So we're all figuring it out. And today we have enough, and we're working on making sure we have enough for the future as well.
Yeah, so we got several weeks in the community, it appears, and there are new supply avenues opening up right now. So that's encouraging. Hopefully, the folks that are saying they have this stuff will be delivering on that, and we will have a better feel for that on certain aspects of it by early next week or so. Darcy Costello. That last question was from Marcus Green on PPE. Darcy, will the city install hand washing or sanitizing stations for the homeless population? So, Doc, I know that was part of our group plan. I just don't know the status of it. Do you?
I don't know the current status as well either, but yeah, hand washing is very important. I know restrooms at parks are staying open, so that can continue. But we can get back to Darcy with that answer.
All right, so our comms team will get with you, Darcy. Okay. Okay, anything else from the media? Okay, well, I just want to thank everybody for joining in here today. Again, look at the brutal reality of what's taking place in New York. Think to yourself, do I want to be part of that happening here in Louisville? And I feel quite certain everybody would say no. Okay, so then say if you're not doing the proper social distancing and these other proper health practices, look at yourself in the mirror and say, I'm going to be part of this solution because I do not want to impact somebody that I love. Okay? And also think about our community and just say, look at all the wonderful things that are taking place. Today we went through what our bourbon industry is doing with sanitization, what we've done to support Dare to Care, all these hundreds of cases of people helping each other. There's a lot of great stuff taking place. And we've got a good organized response to this. We'll let the data decide when we're going to come out of this, and that will happen at some point in time. In the meantime, let's just all work together, get your understanding of the federal stabilization package and now how that helps gives you a little more breathing room financially as well. And then we'll look forward to more of that to come. So thank you to the media. Thank you to the population of Louisville. Let's keep rolling through this virus, okay? Everybody take care. See you tomorrow.